Hi. Welcome to XCEL, a quick guide for excelling in care for patients with developmental disabilities through communication, environment and logistics. This training was designed for reception, administrative, and ancillary staff that may interact with patients in a variety of healthcare settings.
So, what are developmental disabilities?
Great question. When we refer to people with developmental disabilities, or DD, we are focusing on people who have significant, lifelong disabilities. About 15% of the population have DD. They may have intellectual, physical, or even sensory disabilities. Examples include people with Down syndrome, autism spectrum disorder, cerebral palsy, and spina bifida, among others.
We interrupt our training to bring you this important message.
Good evening. Never use the R word, or mental retardation, to describe someone with an intellectual disability. No exceptions. It's offensive, and outdated. And now back to your regular broadcast.
Okay. That seems easy enough. So why the need for this training?
Unfortunately, people with DD do not always receive appropriate and respectful treatment from others. Many people, including some in healthcare professions, are not familiar with persons with DD. Healthcare professionals may get little training in medical and nursing schools, so they are apprehensive around these individuals. Some people have inaccurate beliefs about different types of disabilities. Stigmas which can result in negative attitudes and inappropriate and disrespectful behavior. Indeed, having a developmental disability has been found to be a risk factor for dissatisfaction and disappointment with healthcare encounters. Reception, ancillary and support staff are often the first to encounter patients with DD. As we all know, first impressions matter.
We can set the tone for an entire healthcare appointment.
So let's excel together to make it a good one.
In XCEL, the C is for communication.
How can I communicate effectively with people with DD? How about this? Can you hear me now?
Some people with disabilities have difficulty speaking. Make sure to allow extra time, and don't speak for the person or rely on a family member or caregiver. Focus on the patient first and foremost. Some people with disabilities have difficulty with comprehension. Don't use jargon or abbreviations, just straightforward words. Never pretend to understand when you don't. Be honest.
Sir, I am having trouble understanding you. Please repeat yourself, or use different words. Good evening. I bring you another important reminder. Be aware that some people may use augmentative or alternative communication, AAC, or AAC devices. These can include sign language, a voice box, face or hand gestures, paper and pencil, or a tablet. Now, back to your regular programming.
Encourage better preparation for appointments by giving them some of our resources, including My Health Passport and My Health Report. These documents provide healthcare professionals with more specific information about a person's disability and how best to offer assistance. Don't avoid or skip elements of the office encounter, such as taking height and weight, or measuring blood pressure, because you think they may be too difficult or too complicated.
Reception? I need reinforcements. When communicating, I will be patient, use plain language, ask for clarification, and encourage preparation. Got it?
In XCEL, the E is for environment.
I've got it taken care of. We clean the office every day.
That's great. But there is a little more to it than that. Some people with disabilities have difficulty adjusting to a new environment. Suggest they make a visit to see the facility before their actual appointment. People with disabilities may also be very sensitive to stimuli in their environment. Noise, odors, and lighting can be especially overwhelming. If possible, have a quiet area or room to wait in. Also, try to schedule patients on the first or last appointments of the day, when the office may be less crowded.
Reduce noise to encourage a quieter environment. Lower televisions to a volume that is not distracting, and use closed captioning. To eliminate odors, limit the use of strong air fresheners or fragrances. This includes flowers, and encourage use of low-odor cleaning supplies. Provide steady lighting. Make sure light bulbs don't flicker, and avoid flashing displays.
Accessible environments need to be maintained. Make sure to regularly assess the accessibility of your spaces from the perspective of a patient with a disability. In XCEL, the L is for logistics.
Ah, you mean like getting the patient from one place to another?
That's right. Some people with disabilities have difficulty with transportation and might need to rely on others or formal transportation services to get around.
Hi. My bus is running late. Okay. Great. See you soon.
Here's how you can help. Be as flexible as possible to offer appointments. Give as much advance warning as possible if an appointment needs rescheduling. Maximize what can be done at one appointment rather than having multiple appointments. Consider making these appointments the first or last of the day to allow for more flexibility.
That's it. Now remember, you may be the first interaction with the healthcare system for many patients. By applying these practices, together, we can help increase satisfaction and reduce disparities for patients with developmental disabilities. Now let's get to work.
For more information and useful resources, including those mentioned in this video, visit xcel.flcic.org.